Welcome to another therapeutic medical physics video, and whether you're studying for part 3 of the ABR exam, curious about electron density curves and CT numbers, or have an upcoming diagnostic test, we want to dissect a question in which you may just be shown a graph similar to this and the previous graphic. And the first question, for example, in a Part 3 exam or possibly just a general test you may be taking is, what is this and what is the significance of it? And especially how you obtain it. So when you look at the axes, we see relative electron density, CT number, and HU. And so from this, we can gather that it is an electron density curve. Now, to obtain this, we have to use a phantom that has many different plugs of different materials that we know the HU of. So first, this is just simply the electron density curve, and we have phantoms. They typically come with the CTs that have those materials, and it's kind of just like a cylindrical phantom, and they have different plugs of Teflon, acrylic, something water equivalent, and you know, for example, what the electron density of this plug right here is, and then you can measure it and just create a plot of the CT number versus a relative electron density. And so the next question may be, okay, you have this now, what do you use it for, and do you typically have one, or how many do you need if you are running a clinic yourself? So because the Compton effect in therapeutic energy ranges is the most common, specifically in MV, for the water equivalents you need the same electron density, which is just simply the electron per cubic cm, and that, if you need the equation, is just given by this equation here. Typically, you're not going to actually have to calculate this on a test or the Part 3 exam, anything like that. But the water has an electron density of 1. Now, one thing that is important to know is that the CT number, which is, the HUs, is given by the equation here. Running out of room, unfortunately. I apologize, right too big, and that is times 1,000. So the CT numbers are based on electron densities and the atomic number in the KV beams like CT. The non-linearity, you see that in the beginning, of course this is hand-drawn, you see better in the graphic, it tends to look pretty linear until you hit a certain point, and there's kind of, it dips off. Would consider that a nonlinear portion. This right here is caused by the change in atomic number of tissues. So the correlation of CT numbers and electron densities using a phantom. Now this GAMX phantom, which is what I mentioned up here, you use that once a year annually just to verify these numbers. That's part of your TPS QA, your CT QA annually. You don't use an MRI for this, mainly because it assumes heterogeneity and the magnetic field may not be uniform, so you would get possibly incorrect values and some distortion geometrically. So for CT, you really only need one of these graphs. There's no reason to use several phantoms and come up with many relative electron density curves. For therapeutic, you would want one for, if you want to be very precise, have one for each clinic. So if you're covering 2 different clinics and you have 2 different linear accelerators, you would want one for each one of those. And we use that to find the electron density and the linear attenuation. So these are linear attenuation coefficients there, and that is what we use to base our calculations for a dose on. So if this is incorrect, it may be looking at soft tissue. It's the dose algorithms, the treatment planning system is going to reference this graph that you've put in, or that has been provided for you, but you spot check, and it may say, okay, it sees an HU number of -500 right here. And then it's going to look and say, okay, the relative electron density is approximately 0.8, and that is what it's going to use to calculate the dose. And so if this graph is wrong and your values that you input are incorrect, then that is going to show up in your TPS, and you are going to incorrectly calculate dose, which will then go into mistreating the patient by some amount of dose. Another thing that is definitely good to know, just in general, have some numbers thrown around kind of in your head, is what the values are for air. And I'm talking about the HU values here. Let's just cover some main ones. Air, muscle, lung, bone, water, I've already mentioned, is 1, and we'll do some fat too. So air is at the very bottom here, -1000, and then muscle is 30. It's a little more dense, has more to it. Lung is -700. It's not as much as air. It's not pure air in our lungs, but it's certainly not as much as muscle or something that is more fibrous and muscular. A bone is 1000, so that is one of our top HU values there. Water is 0, and fat is -50. And so that is a brief description of the electron density curve, the Gamex phantom, and why this is important. If you have any questions, please comment below, and look forward to seeing you in another video. Thank you for watching.